Hello, I'm TJ Sidhu and welcome to a very special episode of 9 Months. Today we'll be discussing and understanding children with special needs. Now, these children may have been born with a syndrome, profound cognitive impairment, or serious psychiatric problems. Some may have special needs that involve struggling with learning disabilities, developmental delays, and surprisingly, arthritis. I know this might seem like a lot to handle, but you do know what works best for your child, so just trust your way. However, if you are one of those parents who feels unsure about how to handle children with special needs, then we've got just the show for you. We have with us Dr. Samir Dalwai, developmental pediatrician, founder of New Horizon Child Development Center, Dr. Raju Khubchandani, renowned pediatrician with special interest in pediatric rheumatology, who pioneered the specialty in India, and my very dear friends Ravi and Chitra Iyer, who are wonderful parents to a young adult with autism. So, Dr. Khubchandani, how can parents identify that their child has any birth defects if it isn't obvious when they're born? What are the signs?
So pregnancy is a very unique period in the life of the mother as well as the family. While you always hope for the best, it's important to sometimes plan for the worst. Therefore, there are some indications that one may get, perhaps even before the entire delivery happens.
Like what sort of indications?
Like, for example, there is a family history of a previously affected child, especially if the wedding has been consummated in the same family as consanguinity. Then along the way, during pregnancy, the mother has had a very rough pregnancy. She's been exposed to several medications, or the mother is indulging in substance abuse or alcohol, or the baby is born very premature, really indeed what we call a very low birth weight baby. Or the baby has had a very stormy course in the ICU soon after delivery, the newborn ICU. The baby's been on the ventilator with oxygen at high levels for a long period of time.
So you're saying a child can develop special needs after delivery also?
Yes, sure, because all these events which surround the period of delivery, what we call perinatal events, could then sometimes manifest with special needs showing up later on in life. Like, for example, the example I gave you about high oxygen concentration can be associated with visual defects, or certain medications given during the period of newborn could lead to deafness in the child. And these things may show up only a few months into the follow-up of the child.
So you only find out a few months later?
Precisely.
So I'd just like to take that ahead. When we say special needs, what do we exactly mean? We're talking about a child, and every child gets a lot of care, affection, love and support. You understand that?
Right.
Beyond what is averagely required for a baby, if you need to give something in addition for a consistently long period of time to help the child catch up with what the other children are already doing, that is what I would say is roughly somebody who needs special care or who has special needs. So after what Sir said, that you have a criteria where you have a high risk baby who is at risk for needing special need or special care, because this child is at high risk for having developed a problem right during pregnancy or during the period of birth. As you go along, what becomes evident is this baby is absolutely lagging behind or not catching up or staying at pace with the way the other babies are developing. And hence you would have a baby who is developing slightly slower or in delayed or in a deviant manner, or the development is little different from the other babies. That is when you start worrying whether this is a transitory phase and the baby will catch up, or is this going to be something that we are in for the long haul and we may need to keep providing something in terms of special care for a longer period of time.
How can you tell if they're going to need care longer or if it can be fixed?
So if the gap, so to speak, is not very large and it can be caught up in a little period of time with some little intervention, and once the baby catches up and you keep monitoring the baby and the baby keeps moving along now at that pace like other children, we know we have something called milestones. So these are milestones where we know by this particular age the baby should have developed these skills. If we find that the baby is consistently lagging behind, that's the problem I spoke about. But if the baby has caught up You need to monitor whether the next milestone also the baby keeps time. But if the baby keeps time with the next milestones, you're sorted.
Then it's okay.
If not, you need to keep providing the special care.
So doctor, what is ASD and ADHD? What are the differences between the two?
Well, in the first place, let's not confuse the two because the two are completely different. When you say ASD, I presume you're talking about Autism Spectrum Disorder.
Yes.
Now, to me and the work that I've been involved with, autism, basically the term means self-absorbed or self-involved. To me, that's a misnomer because I don't believe the child is self-absorbed. To me, it means the child is object-involved. The child is obsessed or too involved with objects. And this is at the expense of being involved with or observing humans around the child. So what happens is right after birth, we have this baby who is not really observing the humans around him or her and hence fails to pick up basic nuances of human social development, which is smiling at each other, responding to each other, interacting with each other, thereafter engaging with each other in terms of non-verbal gestures, that is non-verbal language. When the mother waves a hand like this, it indicates to the baby that he or she is going away. Then the baby learns to do that himself or herself and he can wave back at you. And when this goes on, this observing, engagement and practicing human interaction for a year, year and a half, by then the baby's brain develops enough after learning all this to then pick up verbal communication. That along with this symbol, I could also say bye-bye, which means one and the same thing. But bear in mind, it requires the child's brain to have developed right from interaction, non-verbal communication, and only then can you pick up verbal communication, much like you need to first sit independently, master sitting, then you need to master the skill of standing, and only then can you ever master the skill of walking.
Right.
So these are steps which if they do not happen, we find the baby who has a problem in social interaction and impaired communication. Now that is typically what the term autism denotes. Autism does not mean a basic structural damage in the brain like a tumor or like an infarct, like sir said about the baby who doesn't cry.
Right.
It's basically a developmental behavioral concern which comes up because this baby is not picking up learnings as she or he should.
Right. So Ravi and Chitra, you're parents to an autistic child. Did you know right away that Shravan, your son, had autism?
Actually, we got to know immediately post-birth that, he had epilepsy. And like doctor said, in the neonatal ICU, where there were a lot of deficiencies in terms of vitamins. He went through that entire phase of where the first 20 days we didn't know if he was going to survive. Post that, we first got the diagnosis of developmental delay. It was only around his age of 3.5 that we got the diagnosis for secondary traits of autism also. So it was, we were observing, we were first dealing with other challenges of epilepsy. We were trying to get that under control, and alongside came this as the diagnosis.
But doctor, is there any way to, I don't know if cure or fix is the right way to say it, but when you catch it even early on, is there anything you can do to make it easier for the child?
So what I believe is the entire spectrum of autism develops. You have this child typically, like she rightly mentioned, by about 3.5, 4 years of age, where parents first notice it because they observe that the child is not speaking. Because that's something that all of us are aware about, right? We are aware about the fact that the child should sit. So if there is a motor delay, we'll pick it up right then, at 10 months, 11 months, 12 months.
Sure.
But we are not aware about the developmental milestones before speech.
Yeah.
Which is why, unfortunately, almost all over the world, it's diagnosed or comes to light late, because that is the flag that parents pick up. That my child is not speaking, though he's about 2-3 years of age. So unfortunately, it comes to light at that age. Now, like we mentioned, according to me, this is a condition which is developing soon after birth. So the earlier you catch it, what you need to do is you need to understand that there is a train on a different track. The further away it goes, the further away it moves from the regular track.
Right.
The earlier you find that the child is missing the milestones, the whole treatment starts with the first step, that is making this child interact with you and interact with humans. Once the child starts engaging and interact with you and not with this object or that object or with activities which are repetitive. Once you break that and make the child interact with you, the child is then going to observe more and more of your social behavior. For example, the way you are sitting right now, the way I am sitting right now, the way we are interacting with each other, which is not only verbal. And once the child picks up the nuances of social behavior and non-verbal communication, then you move on to making the child understand verbal communication. So my entire message is, if your child is not engaging with you, even non-verbally, even 1 year before age, you don't need to rush into a diagnosis of autism, because that's a taboo word. What you need to do is just get your child to engage with you. And you know what's the biggest competition to your engagement? It's the television and it's the mobile phone and it's all the gadgets and screens around you.
Right.
And you have a room full of toys which are inanimate objects. You need to keep that away, because that's competing with the child's interest for you. Right. And just make the child engage with you. I think that is the primary thing that we must get as a message to everybody.
There are 3 different words we need to look at: speech, language, and communication. To the lay person, all these 3 words mean the same thing. If you subtly dissect, all these 3 are different: speech, language, and communication. And here the issue is with communication. The fact that the child is not establishing eye contact, the fact that the child doesn't come rushing to you to hug you when you come back home, these are subtle features that tell you that there is some lack of social contact. These are the points we need to keep in mind.
Thank you guys also. Now, all children need love and understanding and acceptance. As parents, this is what we can do, not only with your own kids, but also with kids in general. Accept them as they are. Don't be judgmental. Do not be critical. Just let every child grow their own way. Your way is the best way, so trust your instincts.